Thanksgiving is this week. Your plans are probably set. While COVID-19 hospitalizations are down, COVID-19 is still in our community. So as we head into Thanksgiving and gathering with all of our family and friends, how do you do it safely? Well, I know you have a lot of questions, so we have got Dr. Cynthia Snider from Cone Health here. She's the Infectious Prevention Director from Cone Health, and she's going to be here until 6 o'clock answering all your questions about COVID and Thanksgiving. First off, how much of it is a threat in COVID in our community right now?
I wish I could say it was a little bit less than it is as it is. It's still a relatively high transmission. However, I think it is trending down as long as we have more and more people getting vaccinated.
What about hospitalizations? What's it like over there at Cone Health right now?
Over the last week, we've been kind of steady at about 50 admissions per day with folks who have COVID-19.
How worried are you about seeing the numbers increase as people gather over Thanksgiving?
I am a little bit worried that we would anticipate some of these numbers to increase, mainly due to the fact that I think some people may be gathering with folks who are unvaccinated. I think that is one of our highest risks, but I think we are still able to do it safely. And, I think all of us are desperate to, go back to having kind of what we consider a normal Thanksgiving with family and friends. But obviously in the US, there are certain areas that still are having the highest rates they've seen in a long time. And so I think folks who are traveling also, places them at risk also for getting COVID-19 unless they're masking appropriately.
You talked about some people being unvaccinated. I want to go through a couple scenarios that families across the triad are facing. First off, what would you do if it's a mixed group of people who are fully vaccinated and some who are unvaccinated?
So, that is also a good example. We've seen outbreaks that still happen in those scenarios. So folks who are, I think one of the safest ways you can do it is, try to do as much of your gathering outdoors. For the stuff that's indoors, obviously, try to keep your area well ventilated by opening up the windows or doors. And aside from eating, putting back your masks while you're indoors. I think one extra level of protection includes testing. We have plenty of over-the-counter antigen testing, and they do they're pretty sensitive. So, I think, getting one of those tests and getting tested the day that you gather is a great idea, and that creates like another layer of safety.
Well, I'm glad to know that the opening of the windows is a good thing, because in my house we always do that when I burn the food. So at least we'll keep us safe. How much does that change if people are fully vaccinated, if everyone there has the vaccine?
Again, I think that is actually one of the safest conditions where everybody's been vaccinated, and most recently having their boosters. I think the thing that's challenging is kids, right? The vaccine hasn't been out long enough for kids to be fully vaccinated in time for Thanksgiving, I believe. And so kids still should probably be masked if possible. And then still again, as long as nobody has any symptoms or they haven't had any close contacts, to COVID, then I would say that is a pretty safe gathering.
So when you say it's a safe gathering, are we okay to sit around tables and play games together without our mask and do things like that?
It's not, one advice for one family is not the same for another. It really depends on who's in that family. For instance, I have an 83-year-old mom, and, I think for her, I would always like to keep her masked indoors because my kids are not fully vaccinated yet. So, I think any vulnerable family members should still keep masked, but again, if your close family is generally been wearing a mask out like in public places, doesn't take really much risk, I think it's pretty safe to be together.
Okay, what do you do if there's someone coming to your Thanksgiving that is unvaccinated and you're worried about them?
I think it's a great discussion to have to say, would they be willing to get tested? And then again, also, if if that's also a big worry to that, everybody eats, and then afterwards, put on your mask and still be able to have, really good conversation and still play games with masks. And then, if you want to take a break from your mask to go outside or social distancing.
Okay, so the day after Thanksgiving, we all want to go Black Friday shopping. Guilford County just dropped their mask mandate, so not all stores require it. Should we still be wearing our mask in stores, or is it safe to take it off?
Right now the rates are still high in our community. So I would say like the best advice is to always wear a mask in public, especially indoors, obviously, and especially in groups that you don't know people's vaccine status. So for Black Friday shopping, I will definitely be wearing my mask.
In the beginning of the pandemic, we were so worried about touching stuff and sanitizing our hands every 5 minutes. Do we still need to worry about that when we go out shopping?
I'm a fan of hand washing in general, even before COVID. So especially if you're going to take a break to get some snacks or get a drink at a shop or anywhere, definitely still would do some hand sanitize. Take some hand sanitizer in your purse or your pocket to use before taking any food.
After the holidays, if you start to feel a little bad, when do you know it's time to go get tested?
So similar to travel, like if you are going to an area or you think you may have placed yourself at risk, I think a good time to get tested. The soonest would be like 3 days, but definitely like between that time of 5 days to 7 days after the exposure. If you're feeling bad, though, you should definitely get tested.
What about how we keep our numbers going down in the future? The vaccine is the best answer, correct?
Yes. So the vaccine status of our community, it's still, we're really wanting to aim to like get as high as like 90%. And in certain age groups we are, folks who are older than 75. But we know that the vaccine efficacy has waned, has trended down a bit, especially those who've gotten the vaccine back in the winter or in the springtime. This is the perfect time to get vaccinated. And then the biggest news, which I think a lot of parents have been waiting for, was the fact that, the FDA green-lighted the Pfizer vaccine for kids who are ages 5 and up. So, it's definitely safe. It's a perfect time for them to get vaccinated, and, and it gives you coverage for the holidays and the New Year's when they have time to also play with others.
Well, we've already got some viewer questions coming in that we're going to ask right after this break. You can keep texting yours. It's 336-379-5775. Coming up next, can you get COVID from the food on the Thanksgiving table? We'll be right back.